We will just try to have something new. This question was asked by one of the group member about a 60 years old patient, not mentioning the gender, because even gender can change a lot of things. Okay, 60-year female can have a postmenopausal syndrome, which can make some of the things expected. Okay, like hormonal therapy and everything. So whenever we are discussing a case, you should be knowing a lot and everything. Okay, so you have not mentioned about any of the clinical features, any problems, but usually your approach should be that you should be looking for any comorbidities head to toe. Okay, like CNS, respiratory system, cardiovascular system, because if there is for example TB can involve the lungs, there may be fibrosis. Okay, the patient is on anti-TB or not, this can change the things. Spinal TB, if it is in the spine, it can cause fractures if it is involving the bone, osteomyelitis thing of sort of thing. Then so a lot of things you need to see. So whatever we are saying, it's in just like you can say that not every patient will be alike, but generally you just have to see all the system. You have to look at cardiac risk factors, renal risk factors, pulmonary risk factors, and PONV risk factor. So we will see that because this patient surgery will be done in the prone position, so all the concerns with reference to prone position, right, with reference to creation of the position and reversing. In the creation of position, you can have dislocation of the joints and neck injury and this and that, and then abdomen can be compressed, so there will be cardiovascular implications. There may be problems with the genitalia or breast in male or female. Joints may be dislocated, nerve injury can occur. Okay, if his abdomen is compressed, there may be things. So all concerns related to prone position. Then in this case there may be sudden bleeding. Surgeon may be asking for hypotensive anesthesia, so concerns related to hypotensive anesthesia. Surgeon may be doing VOC potentials, so you might be using TIVA or TCI, total intravenous anesthesia, or target control infusion without avoiding with avoiding all the factors which can change the evoke potential. Generally it's better to have a bolus followed by a continuous infusion rather than intermittent boluses, because it can change. Then there should be cerebral monitoring, because if you are having hypotensive anesthesia in this age group, there may be cerebral ischemia. So you can have cerebral oximetry. You can have there are new SedLine and O3 monitor. You can just search in Google and you can find there are specific monitor which can tell you global versus focal. So it is better to have focal ischemia monitoring with EEG, and neurophysiology is a separate department which is doing it. Okay, so neurophysiology, and then sometimes they are because of hypotension and because of involvement, there may be problem with the kidneys. Okay, and there may be problem with the integrity of the spinal. So once upon a time they used to do a very terrible test which nobody does now, that is wake up test. So you should be knowing how to do the wake up test, like how will you avoid the problems in wake up test, how will you teach the patient. So these are the things which you should be knowing about this case. Okay, so all the, then maybe I have missed some of the things, like the side effects of the anti-tuberculous drugs. Okay, and concerns with reference to occupational problems, because you might need to have droplet or airborne precaution. Okay, so you might need to have N95. All the operation theater staff should be informed, and if you have you are not fit for N95, then you need to have this paper. Okay, this purified, which we were familiar during the COVID time. Okay, that's it. Thank you very much.